Now we will address acronyms that are related to government agencies and other organizations. AHIMA is the American Health Information Management Association. AHIMA is a professional association that helps to promote and set standards for the health information management profession, called HIM, which includes medical coders, billers, and others. AHRQ is the Agency for Healthcare Research and Quality. AHRQ is an agency within HHS that helps to improve quality reporting by healthcare providers. Among other activities, AHRQ helps to validate clinical quality measures, which are an important part of the Meaningful Use EHR incentive program. ANSI is the American National Standards Institute. ANSI provides timely, relevant, actionable information on national, regional, and international standards and conformity assessment issues. An ACO is an accountable care organization. An ACO is a healthcare organization characterized by a payment and care delivery model that seeks to tie provider reimbursements to quality metrics and reductions in the total cost of care for an assigned population of patients. An ACO typically relies heavily on technology to coordinate the activities of many different providers. The Patient Protection and Affordable Care Act, often called Obamacare, provided an incentive structure to encourage the adoption of ACOs. CDISC is Clinical Data Interchange Standards Consortium. The CDISC is an open, multidisciplinary, nonprofit standards development organization that facilitates the development of global standards to improve interoperability and streamline medical research. CDSS is a clinical decision support system. CDSS is interactive software designed to assist physicians and other health professionals with decision-making tasks, such as avoiding adverse pharmaceutical interactions and making diagnoses based on patient data. CHI is Consolidated Health Informatics. CHI is a collaborative effort to adopt health information interoperability standards, particularly health vocabulary and messaging standards, for implementation in federal government systems. FHIPR is Federal Health Information Planning and Reporting. FHIPR coordinates healthcare IT activities among the more than 20 federal agencies that provide healthcare services. HHS is the United States Department of Health and Human Services. HHS is a cabinet-level department of the federal government tasked with protecting the health of all Americans and providing essential human services. HI is Health Informatics. HI is a discipline at the intersection of information science, computer science, and healthcare. HIM is Healthcare Information Management. HIM is chiefly concerned with organizing and managing patient data contained in medical records. HIMSS is the Healthcare Information Management Systems Society. HIMSS is a nonprofit organization dedicated to improving the quality, safety, cost-effectiveness, and access to healthcare through the best use of information technology and management systems. HIMSS hosts one of the largest and most anticipated conferences in the industry every year. HISPC is Health Information Security and Privacy Collaboration. The HISPC is an entity under contract with HHS to address concerns regarding the security and privacy of electronic health information. HITSP is Health Information Technology Standards Panel. The HITSP is a body tasked with promoting interoperability in healthcare by harmonizing health information technology standards. It was created in 2005 by the Office of the National Coordinator, a part of HHS. HRSA is Health Resources and Services Administration. HRSA is the primary federal agency responsible for improving access to healthcare services for people who are uninsured, isolated, or vulnerable. It is an agency of HHS. ICD-10 is the International Statistical Classification of Diseases, 10th revision. ICD-10 is a coding standard published by the World Health Organization, or WHO, to provide a common system for classifying healthcare information. In the United States, ICD-10 is used primarily for billing purposes. ICD-10 was set to replace ICD-9 in October 2015. NCVHS is the National Committee on Vital and Health Statistics. The NCVHS advises HHS on health data, statistics, and national health information policy. The NCVHS has review and advisory functions regarding health data and statistical problems, simulates or conducts studies of such problems, and makes proposals for improvement of health statistics and information systems. OHITA is the Office of Health Information Technology Adoption. The OHITA is an entity within HHS tasked with coordinating nationwide efforts to adopt and use health information technology. The OIS is the Office of Interoperability and Standards. The OIS is a part of HHS with responsibility for standards, security, certifications, the Nationwide Health Information Network, Federal Health Architecture, and the Connect program. The ONC is the Office of the National Coordinator. The ONC is a part of HHS focused primarily on coordination of nationwide efforts to implement and use health information technology and the electronic exchange of health information. The ONC also sets certification standards for EHRs. The OPR is the Office of Policy and Research. The OPR is a part of HHS tasked with coordinating studies of health IT. An RHIN is a Regional Health Information Network. An RHIN is an organization created to facilitate health information exchange among stakeholders of a particular region's healthcare system. The RTF is the Review Task Force. The RTF is a task force charged with ensuring consistency in the way HL7 standards are implemented in clinical workflow profiles. An SDO is a Standards Development Organization. An SDO is any organization whose primary activities are developing, coordinating, promulgating, revising, amending, reissuing, interpreting, or otherwise producing technical standards that are intended to address the needs of some relatively wide base of affected adopters. The SLHIE is the State-Level Health Information Exchange Consensus Project. The SLHIE is a part of HHS designed to facilitate health information exchange development across states.